Hi everybody, I'm Dr. Peter Miller, I'm Chief Exec of LPT, and this is the January summary of the world according to me, I guess. So what's been happening? Well, what have we seen in the new year? So Happy New Year, first of all, about the future of the NHS published since I last spoke to everybody. The 10-year plan with a 5-year budget allocation as well. So this is an important document. It's 130 pages long. It is worth reading a summary if you've got hold of one, because most of you are going to be working in the NHS for the next 10 years. And it is going to predict what we are going to do and what our priorities are going to be. So we need to be at least broadly cognizant with its content. So what does it say? What does it focus on? It focuses on prevention, how to keep people out of hospital and how to keep people well. That's its principal underlying message within it. Now, how are we? Because we can't survive. We're not sustainable as an NHS if we admit more and more people to hospital. It's not good for them, it's not good for their health, it's not good for our services, we don't have the workforce, we don't have the hospitals, so we need to, in reality, admit less people to hospital. So what does that mean? It means we need to invest in primary care, and we all know we need a better primary care service, but we need a better primary care service connected with our community services. And so within the plan, there's a plan to increase community services spending by over 4 billion. If you think about what our fair share in LLR is of 4 billion, it's something like 50 million. You know, are we going to invest £50 million in community services over the next 5 years? And what would we do with it? What would that model look like? And it's really clear in the 10-year plan that it's about an integrated service with social care, with primary care. They talk about primary care networks of people from different organisations working closely together to keep people well at home, and especially the older population, the frail older population. So that's one challenge. The other part of it is around mental health, a real focus on mental health. And again, a promise of 3.6 billion over a 5-year period. Again, that's something like between 40 and 50 million pounds of new investment in Leicester, Leicestershire and Rutland in mental health services. There's something we can do with that. You know, again, we need to think about what we're going to do, how we're going to work, making sure that that doesn't just go into inpatient care, that goes into prevention, into crisis, into liaison services, into psychological therapies. And that's what the plan says. That's where the focus has got to be, on how we support people in the community. CAM services, early intervention, and those I anticipate will all grow. So we can talk about growth. There are lots of other stuff in there. There's stuff in there about how we're going to be more digitally enabled and how we're going to use computers and all that to improve people's health in the community. And then there's a whole section on workforce. Because if someone gave me £50 million to invest in mental health services, they're probably not going to do it just like that, but if they did over the next 5 years, I wouldn't be able to recruit £50 million worth of staff. So the biggest challenge in there to delivery of this is our workforce, and we have got to work on how we recruit, retain, train, and also have a different workforce model. So this won't be necessarily all doctors, nurses and therapists. This will be about how can we creatively create a workforce of the future. There are challenges in there. They want us to increase the number of clinical placements by 25% next year. That's a real challenge for those that work in that education environment. They want to increase the number of people through into the universities to get those core registered nursing. But there's going to be more apprenticeships, more nursing associates, more peer support workers, different people working in different roles to support people, both on our wards and in the community. And that is probably the biggest risk around the delivery of the 10-year plan. Give us as much money as we like. We can't recruit anybody to do the job. And that's there are 800 registered nurse vacancies today in Leicester, Leicestershire and Rutland across our services and across those at UHL. That's a lot of vacancies. And it's a real challenge to think how we'll do that. So that's the 10-year plan. Worth a read of the summary, worth a read of the full document if you fancy a couple of hours of your time reading 133 pages. So what's happening in LPT? What's our priorities for 2019? Firstly, again, it's our workforce. We have got to work on and create the right culture. We've been working on it, but we need to do more. And we're going to do a whole piece of work in this first 6 months, recruiting champions, doing a whole diagnostic piece around the culture within LPT. How can we make sure that we create a just, fair and learning culture? So when things go wrong, we learn from them. When things go wrong, we don't blame people, we learn from them. People feeling that they're treated fairly across the organisation. Because we know when disciplinary things happen or when incidents happen, often people feel blamed, and that is not the best way to learn. So we've got to do a whole piece of work around that. That's a big priority for me. We've also got to make sure that everybody in LPT, from whatever culture they originate from, feels welcomed. We should be brilliant at this in Leicestershire and Rutland, given the population that we serve and the population that we draw our staff group from, but we're not. So we've done some early diagnostic work. We've asked a national race equality team to come in, and they've been doing some listening exercises over the last week, and we're having a conference with them and with a whole bunch of staff on the 11th of February, again, to think about what is it we can do this year to make sure that all of our staff feel welcomed and equally treated. So 2 big priorities. There's loads of other things in terms of workforce, in terms of retention and recruitment, but those are 2 big things. We've always got to focus on the CQC and make sure our services are safe and well led. And I anticipate getting the draft CQC report through in the next 48, 72 hours, which will land on my desk. It won't get out to everybody at that point. We'll be looking at it for factual accuracy. I have to respond to that within 10 days. And then probably a week to 10 days after that it'll be public. So I anticipate the report from the inspections they did in November and December will be probably published in the middle of February. And then obviously we'll be reading that, working out what we need to do to respond to that, to make sure that we're providing safe and effective services across our trust. And then finally, we really need to focus on the transformation of some of our services. And there's 4 key transformation areas that we'll be putting our efforts and time into this year. One is around the all-age mental health transformation programme, making sure that our community mental health teams, our inpatient wards are functioning to their optimum efficiency and effectiveness. There's still a huge piece of work to do in CAMHS and our children's mental health services. There are still, despite the best efforts of our children's services, there are over 500 children waiting for treatment, some of them who have been waiting for up to a year. That's not the service that any of us want to provide, and we've got to work with our commissioners to make sure we've got the appropriate resources into those services, and that we're working at our most efficient in order to deliver that care. We want to make sure that the electronic patient record is fit for purpose, which means having a single electronic patient record across the organisation, which will be moving away from RIO, moving on to System 1 for mental health services. Then we will have a single record. That will be difficult, no doubt about that, and that will happen in early 2021, but it will bring advantages. It will mean that all of our staff are on the same system, and it will mean that we're on the same system by then as nearly every GP in Leicester, Leicestershire and Rutland, which will make sharing of information much easier. And then last but by no means least is the community services review and the implementation of what will be locality-based integrated teams of people, teams of nurses, therapists working with primary care at locality and neighbourhood level. Now, I don't think anybody thinks that's a bad idea. I think that's probably the way forward. Getting from where we are today, making sure we take our staff with us, from that position to where we want to be is going to be quite a challenge. And we'll be implementing that over the next year or so. So there's 4 key pieces of work that we'll be focusing our efforts on. There's lots more to go, but those will be 4 things. So our workforce through culture and a just and learning culture, how we respond again to the CQC report, and those key transformation programs which will focus on quality and the effectiveness and our ability to respond to the demand on those services. I think that's all I want to say at the moment. So thank you for listening, and happy to take any questions. Thank you very much.